Welcome everyone to RSH 2025. I'm really privileged to be with Dr. Omar Khalique to talk about multimodality or imaging evaluation of degenerative prosthetic valve. Omar, thanks for being with us and nice to see you at RSH.
You're welcome. Nice to
Yeah,
see you.
yeah. So as we implanting more transcatheter therapies and now in low risk patients, these valves are degenerating. So what kind of tools and imaging modality we have for evaluation for these valves?
So this is actually a very intense imaging area because this is where we can really use every single modality. And this is coming up in bryoprosthetic surgical valves and also now in redo tabs, so degenerated tabs. But the same principles are going to apply. So our baseline test is our echo, right? And that's what we follow over time. And there can be signals there which can then trigger us to do other evaluations. So once we see reductions in our effective orifice areas or increases in our mean gradients of at least 10 or mean gradient absolute of at least 20, these are some of the factors that can lead us to say there might be some degeneration. And now we need to move on to the next steps. Now, when we categorize our valve degeneration, it could be structural, non-structural, or other things such as thrombosis or endocarditis. So that's where we're going to use our other imaging tools.
Yeah.
So the CT,
Yeah, so it's going, next one.
so the CT can give us more precise information on the leaflet thickening and the mechanism that could include thrombosis, pannus, or endocarditis. From there, we could move on to other investigations. For example, if we think it's endocarditis, then cardiac PET is a good modality to help us see if there's inflammation because it may not always be clear just from leaflet thickening. And then other mechanisms of degeneration, such as regurgitation, central or paravalvular. So we need to delineate which one it is. CMR can be an important modality there because the quantification can often be difficult just from echocardiography. Yeah. And we have cutoffs like regurgitant fraction of 30%, which is very similar to the growing data with CMR in native aortic regurgitation. That's where our prognosis gets much worse. Right. So we have our full array of modalities, echo, CT, CMR, and cardiac PET, and we need to use different combinations of these to really outline the etiology and stage and then make our decisions on whether we're going to do a valve-in-valve or a surgery thereafter.
So you have a big flux of data coming in about a certain valve. Is there any use or utilization of AI for putting all this modality together to give the best therapy for these patients?
So that's a good question. There's a lot of hype around AI. I think to get to the point you're describing, we're still somewhat far away, although the growths in technologies are exponential. Right now, the AI, we're just trying to get it to measure things correctly in an automated fashion. That's where we are, and we're not there yet. But I think certainly that's a future use of AI because we have all of these modalities, multimodality, but we don't have registration of all these modalities to really combine the information in an automated fashion to give us the best diagnosis.
Final question about 3D printing. As we reach a phase sometimes, I heard about it a few years ago, about in preparation for the valve procedure, whether surgical or transcatheter. Are we still utilizing this kind of 3D printing?
So I think it's being utilized sporadically and also based on local expertise. But I think it can be useful for certain cases. For example, a paravalvular leak closure where you want to see it's a very small anatomy and you need to see whether putting in plugs of different sizes are going to obstruct the anatomy. And perhaps there's still some questions based on the echo and CT analysis. So I think there's a role. I think it's a limited role currently. And then there are other aspects to it, like what are you printing using single materials, multi-materials? What is the quality of the 3D printer that you have? But I think it does have an ancillary role for some of these cases.
So I believe, based on your comments, this is an evolving field because now we're going to have more people implanted with prosthetic valves. So multimodality imaging is key in these cases.
Absolutely. So the more valves we implant, unfortunately, the more are going to degenerate. So then we need to look further down the line on how to evaluate and treat all of these patients.
Omar, thank you so much for your insightful intake on that topic. Watch the videos and others on the YouTube channel and webpage. This is Chadi Alraies coming to you from Riyadh Structural Heart 2025. Omar, thanks again.
Thanks, Chadi.